On behalf of our little company, Associated Patient Advocates, it is my privilege to welcome you to our monthly presentation. As usual, free and open to the public. How did I get started in this? I was a practicing physician. I think every healthcare professional is in many ways an advocate for their patients or clients. When I was in practice in general medicine, internal medicine, I had the opportunity to haggle with insurance companies, pharmaceutical companies, specialists, translate things into English for patients, and in general, try to get them the best possible care. There are many obstacles in the American healthcare system, which all of us are aware of. After I got out of active clinical practice, I spent a lot of time visiting friends, patients who had become friends, advising family members who were confused, overwhelmed, and addled by the healthcare system or non-system in the United States. So with like-minded friends and colleagues, we founded a small company to help people with their little journeys and not so little journeys into the healthcare space. So all of our presentations are on Tuesdays, typically the second Tuesday of the month at 6:30 in the evening Pacific time for those working people. We record them and also put them on our YouTube channel and on our website. They are on a variety of topics, which you are welcome to visit. We have done things like picking a care facility for mom and pop, new developments in breast cancer, how to pick a Medicare plan. We do try to mix it up. For October, I am thrilled to be able to invite my colleague and friend, Brenda Rueda Yamashita, who has worked for the Alameda County Health Department for many years. She ran their diabetes, hypertension, asthma, other chronic disease programs, and has recently retired. The county has now hired 4 people to replace her, and she'll be talking about what is it that your local health department does for you and how you can help your local health department. The next few presentations are given by my colleague, Susan Bucker, who is a licensed clinical social worker who is our mental health expert in our company, and she'll be talking in a series of 3 sessions. The holidays coming up, how to get past the expectations and the blues, and planning for the new year. And in February, we are expecting to have a discussion from another colleague on health equity. However, tonight it is my distinct honor and privilege to host my colleague, Joanna Smith, who is one of the greats and pioneers in the field of healthcare advocacy. Joanna, as opposed to the founding fathers, is one of the founding mothers in the field. She founded the national organization, which is the National Association for Healthcare Advocacy. She also has taught at the UC Berkeley program, training healthcare advocates, and continues to train and consult for people who want to become more involved in healthcare advocacy. She also works as an active patient advocate. Joanna has training as an LCSW as well as a master's in public health. She was invaluable to me and my colleagues when we started our little company, and it is a thrill for me to be able to present Joanna Smith. Thank you.
Great. Hi, everyone, and
Hello.
welcome.
Hi.
Thank you, Harley, for that introduction. I am just, I think I was not feeling very inspired when I put together the title for this program. but I'm very inspired about healthcare advocacy. And it looks like there's a lot of people on this call that are already doing it in various ways and shapes and forms. So I don't want to bore the people that know all of this. So I'll sort of go through some basics about how the profession evolved. And then I have a case study of a client that I just worked with that I thought I'd put up that has some interesting quirks to it that we can do as a group discussion. Because one of the fun things about advocacy is getting a group of people together and looking at a situation and seeing how we all would do it differently. So this is really exciting work that advocates do. And my background is I'm trained as a medical social worker and hospital discharge planner. And in the early days of doing hospital discharge planning, and I'm talking in the 1980s, people would leave the hospital and we'd never know what happened to them unless they showed back up in the ED again. And then we'd get the update on what happened. So I got kind of curious about what happens when people walk out the door of the hospital. And it led to an interest of mine in providing a service where I really could follow people everywhere they went. Inpatient, outpatient, skilled nursing, pediatric cases, young adults, seniors, all kinds of clients, all different age groups. And that was sort of the genesis of my thought about doing this as a practice. That was in the 80s. And what I did at that point was I talked with a group of friends and said, I'm thinking of starting this business. I don't really know what to call it. Do you have any ideas? And we were all on a very long car ride from Ashland, Oregon, back to Oakland, California. So we had plenty of time to think about names, and people were throwing out options. And then somebody said, healthcare liaison. And there was this silence in the car. And I thought, oh, I think that has possibilities. So I ran home and grabbed the URL. That was probably in 1988, but didn't do anything with it for a long time. I like to think that the real genesis of this as a profession probably came from the 1980s in the era of managed healthcare, because at that point we were starting to ask patients themselves to accept more responsibility for choices within healthcare, which, as we all know, has some pros and cons, because what's happening in healthcare is there's lots of exciting things happening. But the downside of that is that much of the population is not, they don't have a high level of medical knowledge and education themselves. So decision-making gets harder and harder for people because they don't have the background to make the decisions. So I think that all of this evolved out of the 80s when we basically said to people, you are going to be more responsible for your health care and you're going to pay first healthcare dollar. And so that really pushed people into doing more research, starting to look at, what are my choices for treatment? How do I figure that out? And we go into the 90s. And by the end of the 90s, I was managing a discharge planning group for a temp staffing agency in the San Francisco Bay Area. And I started looking at, could I take this entity, Healthcare Liaison, that I had grabbed the name for years ago and turn it into something. And so in 2005, I incorporated Healthcare Liaison as a healthcare advocacy business. I was not the first, but I had a really ingenious advisor, business coach at that point. And she said, this is a brand new profession. And the biggest problem I ran into was probably what everybody on this call runs into when they start their profession, or their business, which is people don't know who you don't know what it is that you're doing. And when you explain it to them, they say, where were you 3 years ago when I really, really needed you? So the need was out there, but in the very beginning days, it was a massive amount of education that I was doing of people who heard about me and said, what is an advocate? What is it that you do? So it was a lot of education and presentations about the field and the profession. And my business coach was saying, you know what, this is too much to do as an individual. You have to start the national organization and get people in it, because then geometrically the knowledge about the profession is going to expand. And I remember looking at her and thinking, doesn't the state or somebody have to give you permission to start an organization? And she sort of airily said, oh, no. You just go ahead and start it. Just go do it. So I did. And that was the genesis of the National Association of Health Care Advocacy. I incorporated it originally as a private for-profit entity. It's now a 501c3. And it did just what we all hoped, which was to expand knowledge about the profession geometrically into all different parts of the country. So that was exciting. So I'd say this profession was evolving in the 80s. Some people were doing it in the late 90s and early 2000s. And then probably between 2007, when I founded the 2009, when I founded the National Association, and now there's been an enormous spread. So there are advocates now in every state in the country. Some states have a lot of advocates, some states only have a couple, but definitely it's expanding as a profession. And more people are working nationwide because of tools like Zoom, which allow advocates to see people in any part of the country and internationally. So that's all been really exciting. I started the credentialing program for medically trained people who wanted to be healthcare advocates in 2007. And I've been doing that steadily through up until now. And the goal of that, again, was to expand the profession, get more people doing it, and give people a knowledge base about how to do the advocacy. So I'd say the last 20 years have really been the growth period for healthcare advocacy. Where are we going? Medicine is getting even more complicated. As I said before, lots of choices, and that's good news and bad news. So I like to, my favorite New Yorker cartoon is from years ago, where someone is sitting in front of a physician's at the big desk in the office, and the patient is sitting there going, I want that surgery that I heard about on All Things Considered yesterday. And that's kind of where some of this has really evolved. People are listening, they're talking, hearing about other options in healthcare. But what is not up to speed yet is medical literacy. So we have some people who are very savvy, know how to do good research online, and have good decision-making skills. We also have a lot of people that aren't medically literate, have low medical literacy, and don't know how to make decisions about their own health care. So one of the things I personally love doing most in advocacy now is working with people around their values clarification, what it is that they want from their healthcare system. So then we can start looking at, does that new whatever it is out there really fit for you personally with your own value healthcare system that you want for yourself? Where does all of that fit together? And for me, that's the most exciting part of the advocacy that I do now. I'm no longer doing a full-fledged practice. I do a partial practice that's more consultancy based and continued training of other people that want to go into this field of the advocacy. So the focus I now have more is on working with people who are considering medical aid and dying in California, and helping them with the same process of, does that particular possibility fit for you with your value system about what you want and what kind of treatment you want? So for me, it really has integrated a lot of what I love most about advocacy and helping people at the very end stages of their lives. So I think I'll pause a minute here and see if there are any thoughts or questions. Many of you have been in this field of advocacy yourselves. Any additions, thoughts, questions about anything I've said?
Hi, Joanna. Can you speak more about the training that you said you were involved in early on with medical professionals? Are you referring to some of the programs in university settings?
Both. So I participated in training in two ways. One is I'm an instructor at UC Berkeley in their certificate program in healthcare advocacy. That's what it was in the early days. I've taught there for, oh my gosh, I think 10 years, teaching the introductory course in healthcare advocacy. And then before that, I established my own program through Healthcare Liaison, where I trained people who were medically trained already, had medical licenses. And what I was teaching them sort of on top of that medical license was about advocacy, about how to start the business, about the clinical aspects of it, the issues that we come up with, ethical concerns, those kind of components.
Thank
And do
you.
you still do that with
Yes,
Healthcare Liaison?
I do. I'm no longer credentialing people. I'm doing it as a training program, as a business startup and clinical training program for people that want to go in the field of healthcare advocacy. The thing for medical professionals, for those of you that are on the call and have licenses, is advocacy is already built into your license. You don't need a separate credential to do healthcare advocacy. I started it as a credentialing program because I was really working on trying to expand the knowledge base nationwide, that there were people out there doing this. Now that that's happened, I don't need to offer a credential for it. Now my goal is to just get more people who are medically trained and get them in the field doing this, because I find it so exciting. Most people want to do this because it just is a continuation of all of the skills that you've used for years and years and years already. It's just sort of recalibrating them with some differences in the world of advocacy.
Joanna,